Hello, my name is Michelle Hogan, and I wanted to make this post with Dr. Gulani today here for Monday Morning Motivation on the Facebook post. I had LaZrPlastique surgery, one in August, one in September by Dr. Gulani, and I have the privilege of being able to see very clearly. But you all have very many questions for us on the post, on the Facebook forum, and so I want to get to them. And Dr. Gulani took a Monday morning out of his day to spend some time with me and answer these. And I want to go fast because the posts get too long.
Sure.
So on Facebook, Doctor, we're all very busy people. Dr. Gulani, seemingly all of his patients are very difficult, very type A, want an answer now, very skeptical. And all of these people on Facebook want to know if we are getting paid by you because they believe it's advertisements. Even though what we're doing is sharing our story, we're so excited we can finally see, and we just want to share our success with other people so they come see you. So they want to know if you're paying us.
I couldn't pay you enough. For everybody out there, again, when my patients ask me to sit down and answer questions, it's always a pleasure. It's Monday, we've seen patients landing here from all over the world. And what's your vision today, Michelle, despite your radial keratotomy scars?
It's 2020, and I did have 8 cuts in each eye, bulging cornea, astigmatism, cataracts. What else did I have?
Correct. And how's your reading?
Oh my gosh, you guys, this is the best part. Okay, so my phone, on my cell phone, I can see all the way up to here.
So very important, doctor, for all of you. First and foremost, this is not a guarantee that I give. Even though I'm blessed, majority of my patients, no matter how complex a radial keratotomy situation is, are seeing, and even without glasses, and many of them at 20/20 without glasses or contact lenses. But that's not my guarantee to you. In fact, you remember the consent forms you sign and the hours I spend with y'all reviewing things before I go for surgery. But what is guaranteed is my fight, unparalleled fight. I use all my knowledge of 3 decades, every skill I know, every technology that I bring into the world, and apply that to help you. So I'm indebted to my patients. I mean, all of the patients of RK who come here to me, most of them are surgeons, attorneys, very busy business people. The fact that you all are taking your time with no incentive, please, no incentive at all, not even a thank you card, because I'm truly indebted to y'all. And that y'all are taking your time on these forums and spreading the word. I don't want it to be about me. I just want this to be inspiring for other doctors so they don't give up on you. That's pretty much it, Michelle. I mean, how can I thank y'all? Y'all have allowed me for 3 decades to execute my passion. Yes, your cases are difficult. Yes, y'all are unpredictable. Yes, it's very, y'all are even skeptical. Many of you have researched me. I call it, y'all have stalked me
Yeah, it's
for
true.
years before coming here, trying to see some negative thing about me. I'm just blessed with your results. All of you keeps on addicting me to perform more and more and help y'all as much as I can.
I have 5 more questions. So I believe you are the off-ramp doctor. And the reason why I say this is because surgeon, by the way, because he takes people, took me, where 4 others had said no, absolutely not. Because we're difficult, we're a liability, we're just too much. Why are you the only one that says yes?
I feel for this. I feel for y'all tremendously. I never did a single RK, by the way, guys. I respected the doctor who invented this surgery, but I never agreed with the concept because your cornea is made up of layers like this horizontally. Cutting it vertically will never be stable, and that's what was proved right over the years. So many of you changed. But again, nothing wrong your doctors did. They did what they could for you. So having not done a single radial keratotomy and refusing to do it, somehow I've become the final destination for all of you RK patients from all over the world. So to me, it's become a passion. And then seeing you all see so well, it just makes me say yes to the other batch who's landing every Friday. And then again, I go through the cycle. And on top of that, the commitment. Now, I've taught surgeons, like I said, for 3 decades all over the world. Many of them come here, they get to see. Our videos are so transparent. That's real time what you guys see. And I would love for other doctors to do this. But I guess it's a lot of commitment. Doctors are very busy seeing a lot of patients and doing routine surgeries, which does make a lot of money. But to me, this has now become a calling. And many surgeons who I've seen later after they visited here, they're awestruck by the outcomes. They love the skills. But I think they have decided that it's not worth the time they have to put in. I see all For how many hours before surgery?
Oh my gosh, 3, 4, 5 hours.
For 2 days.
2 days in a row.
So
Yes.
I don't even let them go for surgery till I've done the evaluation on 2 separate days for hours myself, trying to find what I call my gold or the vision potential despite their RK cuts. I've done people from 2 to 4 cut RK radial keratotomy incisions right up to 48 cut radial keratotomy incisions I've consulted and helped. So it's very important that doctors do find the reason to commit to you all. And yes, you all are complex and difficult, but it's a pleasure. You all are type A, that's why you had RK. Many of you come with skepticism. You're, like I said, they researched me for years before coming here. And you're very knowledgeable, but to me, all that's a plus. The fact that, like I say, and my article says that, you're like lions stuck in a cage.
Which doesn't work.
And the fact that you're rattling the cage doesn't mean you are going to harm somebody. It just means you really deserve to be out. So as a surgeon, you have to be confident and caring to enter the cage because you will get a few scratches. The surgeries are very complex. I mean, imagine what I have to do. I'm looking through your broken cornea cuts and operating on the lens inside the eye, and then I have to optically correct you. Meaning, without touching the RK cornea, optically correct you with the lens implant to land at vision, and then hope your brain picks up from there. And all this without stitches, without injections, needles. And I love to do it in my surgical spa where I can have an experience too. So all these things that we show you, the videos of day 1 that they see of you coming out of surgery, is actually not for patients. These videos I make, my staff and team and learning surgeons make here, are to inspire my colleagues that this is how the surgery should be, despite them being so difficult. Can I operate in the few minutes with music, without injections, needles, or stitches, and bring them to vision? So the videos, many of them are asked, like you said, about long-term. Our long-term outcomes, we have patients now over 29 years since we've done their corrections. They're all doing great. Now, please remember, again, just being clear, this is medicine. I mean, did any part of your body still work as it did 5 years ago? No. How do you expect the RK cornea and the RK eye to do the same? But yet, people put my feet to the fire all the time. They call my patients from 2 decades ago in different parts of the world. Are you still doing great with Dr. Gulani's work? And thank God they still keep saying, yes, we're doing great. And again, no incentive. So it's a huge price, Michelle, I pay. And when doctors meet me after I've taught them and they meet me at dinner time, many of them confide in me, it's too much. They don't want to be so involved. To be so involved, to measure you yourself and then perform these very difficult surgeries and then to meet expectations after that and then to follow through.
Right.
It's intense, but to me, it's become a calling.
It's worth it.
Absolutely worth it.
I have 2 more questions. Keep showing up. Which lens? And the last one is, what is the cost? They ask constantly, what is the cost?
Certainly, they have a right to. So what lens? So this is another thing that is very misleading. People nowadays, when they're having cataract surgery, doctors give them a menu of, do you want the platinum, gold, or garbage package? I really don't think that's how medicine should be. And that's an analogy to which I would say, if a chef knows only how to make a burger, a hot dog, and a burrito, well, that's all you're going to get. And that's because that chef is limited in the skills only to that 3 options. There are 34 lens options in the United States, over 80 all over the world. How to pick and choose depends on many things. Think about it. If you put the same ingredient, which is excellent, just released by FDA, but you put it in coffee and in curry, no, does not make sense.
Exactly.
So the recipe is more important. The vision recipe is what I call it. How many cuts do you have is one small factor. Yes, the more the cuts, more complex, but there are many more factors I've explained to you. Is your cornea normal? Is it bulging? Does it have high irregular astigmatism? Has it got scars? Are your RK cuts open? Do you have associated Lasik or PRK that was done with it? Do you have Fuchs dystrophy in the back of it? Do you have associated angle anomalies? Do you have retina involvement? How or what kind of a cataract do you have? Posterior subcapsular, anterior, dense central. So many things going on. The optics, anatomy, physiology, and finally your brain, the computer. So that's what I do so much planning for, Michelle. Like you know me, I come in on the weekend before and sit down quietly and do hours of planning for your surgeries when you come on. Everybody flies in on the weekdays. That decides the lens technology. That optic then works for the rest of your life. And many of these are off-label. The FDA have not approved that for that case. Now, there are some newer lenses that have come out. Some lenses are called adjustable lenses. But again, the fact that it's adjustable, don't you understand that whoever's doing it is confident that they can't reach the goal? What if a tailor made a suit for you and said, there are 5 adjustments I'm going to include in this for you in the price? Now, what do you know about the tailor?
Not very good.
So again, nothing wrong with it, but this is my philosophy. Just think about it. It's so simple. So yes, there are many things that can be done, but why not work very hard up front and try and land at vision? And then on top of that, your RK still has to heal after surgery. And your RK on top of that keeps moving. So there are so many challenges. Hence, I don't like people fixated only on the lens. There are everything else that goes in the technique, technology, anatomy, everything, and then the ambiance of surgery. Can you still make it a pleasant experience for you?
Right. Well, that's why I loved the consultation, because if you are unsure, if you don't know if Gulani is for you, although he's for everybody, he's totally for me, you got to come see him, which is why I feel that the consultation is so important, because that's where you take all of those measurements and you look and you see the whole person.
Absolutely. No other way out. No other way out. I mean, I've been known to be very firm. I may send patients flying back if they don't understand my philosophy. So it's my honor and privilege to help patients with radial keratotomy. And your level of complexity doesn't decrease my desire to fight for you. That's it. It's so simple as that. As I've said that before in my many teaching forums all over the world, a doctor's inability shouldn't become the patient's disability. So if you had radial keratotomy, you got to stop being told that you made a mistake. You did what you thought was right many years ago. You got to stop listening to someone saying nothing can be done, live with it, or have a transplant. I mean, scleral contact lenses and hard contacts and specialty contact lenses are excellent for RK patients, but provided surgery has been done to first fix you and then that corrects your residual vision. Cannot just wear contact lenses on RK and go about. It's like wearing a crutch over a broken leg, let's say, right? So you're able to walk, but every time you remove the crutch, you can't walk. You realize your disability. Same thing with contact lenses. And then you take the expense of contact lenses over years. Now here's the most important part. Many of you wear these scleral contact lenses for 10, 15, 20 years. Of course, thousands and thousands of dollars you've spent. And here's the best part. By the time you'll then come to me, you have scars, your corneas have thinned out, your RK is irregular because the contact was sitting hard on it. And the fact that you could see was because your incentive to see was so high, they disregarded the pain underneath.
Right.
So it makes it very difficult for me then to fix your vision. So remember, contact lenses, scleral contacts are fantastic boon to patients with RK, but that should be used after you are surgically corrected. After surgically, that bone has been corrected or put together. Then you may use a crutch for residual vision, but the aim of the doctor should be, can I make you see without the crutches? That's really a philosophical thing. No guarantees that you will see without glasses or contact, but it's my privilege. Most of my patients do, and that keeps me going. And regarding the cost of surgery, as you know, if someone is making or doing the same cookie cutter surgery on everybody, then the cost is very clear. It's that cost because they use the same technique, technology, concept on every patient. But when you're designing every surgery to each patient, especially in radial keratotomy eyes, then everything changes. Your surgical healing, your days of stay, the cost of surgery and everything with it. So for example, let's say you have radial keratotomy, but you have associated anomalies with it that need to be corrected during surgery, or technology that you need to surpass your optical errors that are there, plus using various things that we need in our surgical suite to do the surgery, including the way the diagnostics are done, as you can understand, diagnostics, some of which are perhaps intense, as you can see, very advanced, cutting-edge technology to see your vision capacity, your anatomy, your correlates. So each of you RK patients are so individual. Even your each eye is individual because it wasn't done with a computer laser. It was done by a human hand. So even with each eye, you all are so different. As you know, I don't operate on RK patients until I wait 2 to 4 weeks sometimes, because I want to see how did you heal, how did you land. So the cost of surgery depends on so many things which can be determined. And what we've done because I have a lot of out-of-state, out-of-country patients, we let you do a teleconference where you send your doctor's latest reports, and I will personally review with you. That gives me some idea of where I'm headed, and my staff can then at least give you, let's say, 90% accuracy of this is the cost and these are the number of days we need based on what I picked after our teleconference. And of course, when I see you in person, that's when I confirm everything, exactly what custom designed surgery I want for you, what technology I'm using, what concepts are coming together, how many things I'm correcting, and then you have the exact cost, the exact days of stay, and that takes that step. So surely, And the other question you asked me about long-term results, it's very important to understand. Radial keratotomy, because I've got this question sometimes from patients I've done and they're thrilled, but they ask me back a question retrospectively. Is, Doc, when we had RK, we thought this was the best thing, but now we are seeing bad. How do you know what you're doing cannot turn bad? Very simple. Radial keratotomy was done on a virgin eye, on the cornea. It's very simple to predict that where you will land. But because I believe the concept was, I shouldn't say flawed, but not in my philosophy right, the corneas started destabilizing, got more flatter, and the vision changed. What I am doing is what you need anyways. All of you RK patients are now in your late 50s at least, and of course above that, 60s, 70s, 80s years of age. So you absolutely need someone to do your cataract surgery. So simple.
True.
So what I'm suggesting is not doing something that you don't need. You need it. But how we are doing it, using the LaZrPlastique concepts that I have proprietary and I've built up over 3 decades, or using the technologies how I do, how the concepts I approach with, how that is done is what's unique and different about how I'm doing it. And that's why the results is what we have. So what we are doing, it's not an elective, it's elective in a way, but it's not something that you're experimenting or doing something new. It's new from the way I'm approaching, performing, and delivering. But you need cataract surgery. If someone needs to work on your cornea, you need laser plastic surgery. So, and none of these, of course, on paper, everything can go bad or you can lose your life. I mean, none of these are taking you backwards or incorrect or wrong.
Right.
And none of these, at least in my experience, has led to a transplant or blindness. I hope never.
Right.
So the real answer to this, even though nobody knows future, but I've seen it for over 3 decades. I know it. 3 decades is good enough. If you're in your 60s, you'll be in your 90s by then. But my point being, what I'm doing is what you need anyways. It's just doing it in a way that helps the RK people see and get about their lives. And then we do the m.o.i.s.t therapy, further enhancing it kind of thing. So that's the real answer to people who are saying RK worked and we were happy and now it's not working. Who's responsible? Well, this is the answer of that what we are doing is not something experimental, but it's completely logic and futuristic, and it's paradigm shift in the way I want doctors to approach your cases. So you need the surgeries anyways. That's how we are doing it. That's different. Does that answer that question?
Yes, and you guys, he made a great point, because on the forum, everybody is so focused on RK. Just because we have RK doesn't mean we don't have a host of other
Lovely
challenges.
You have become, your difficulty in reading is from age, presbyopia. Your night vision has gone down. Your distance vision is down. Your fluctuation of the RK continues. Your RK cuts are surely there, but you also become dry eyes. So that's what I also want you to understand. Your surgeon should be holistically well equipped. Should know how to correct all of these factors. I'm not saying glaucoma, retina, that's different specialty, but to correct this whole system, because even your tears decide your visual quality. So many of my patients, even though they're 20/20 after I fixed their RK cases, I do m.o.i.s.t therapy, my dry eye treatment, a few months later, and give them even more higher quality of vision with a good fluid on the windshield, if you may, right? So don't underestimate the surgery. Surgery is very difficult, especially for someone like me who wants so much for you. I am looking through the broken cuts and corneas. I'm looking through the irregular system, and I have to operate and be perfect and come out without a stitch. And I want you to have a great experience, and I want to be optically correct. All of this is happening in a few minutes. That decides your vision and how your brain understands it. So understand the seriousness of what's going on.
Yes.
Just having RK is not a taboo. It's not a
No.
curse. You did it. It's okay. Water under the bridge. Let's move on. But I want the world to move in the right direction. I want doctors to fight for you. I want patients to be knowledgeable. I want you all not to give up. As usual, I've turned your small question into a long answer.
That's okay. We needed it. I thank you so much. We can do these as one post or two. I don't care. I'm so excited. Thank you so much for your time. I appreciate it.
She brought her mother in today. I'll see her shortly too.
I did. I brought my mother in because, I mean, if you value anyone in your life or your vision in your life, please see Dr. Gulani. Thank you so much.
Oh, my pleasure. Anytime for you. And go on our website. We have a YouTube channel. Again, we do not advertise. We do not do deals, discounts, anything here. Everything is just plain and simple. But I have a genuine desire to inspire my industry and fight for you all. So go on our YouTube. These are real patients, very intelligent people, very busy, very accomplished people. But they are going out of their way for no incentive to do these videos for y'all and keep on inspiring y'all. So y'all can go back to your doctors and demand something be done for yourself. And you deserve it. You deserve it.
Dr. Gulani, thank you. I know you're busy on a Monday morning, but I wanted to make sure we got these answers for you in our forum. So thank you so much. We appreciate your time.
Always a pleasure, Michelle.
By the
Always
way,
a
he's the
pleasure.
GOAT, greatest of all times, just so you know. Thank you.
Thank you.